Very good morning. We decided to do our study on the medical reference librarian in an academic setting. Because the reference medical librarian has to serve many users, like the researchers and practitioners, we chose to focus on the practitioners that are people who not only do research, such as physicians, nurses, and any healthcare provision staff. We defined 3 barriers that are the disconnect between the librarian and the practitioners, librarians' understanding of a librarian and library services, the time crunch that is felt by the librarian, and the budget constraints that the medical reference librarians have always to do more or to come up with new services with limited budgets. We chose this topic because 2 of us already work in a reference academic medical librarian setting, and we found the opportunity to be working on this research really interesting. The objective is to determine how does the reference medical librarian cope and come up always with effective services to the patrons, that are the practitioners here mainly, given these constraints. Let's talk about the first constraint, which is the disconnect or the connection between the librarians and the patrons. The librarians' greatest current concern is how are they valued by their institution and the patrons, especially in the medical hospital setting, because it is so metric driven and bottom line driven, which is thinking about how many admissions are there, how many people are admitted. So we're talking about quantity. So we're talking about money. We're not talking about quality. There's a study at the UIC Medical Library that showed that there was a significant 30% decrease in the reference transactions happening. Between the year 2009 to 1990, there was 30% decrease in these reference transactions. There's a need to improve on how electronic resources are seen or provided to the patrons. There's a difference in the language that the patrons talk or the practitioners talk and the librarians talk. So the librarians come up with certain key terms and the practitioners come up with another key terms. So there's a communication problem. That's why it has to be fixed a bit. How can this be fixed? Also by designing well or user-friendly web pages that help the patrons or the practitioners navigate through it easily and not be very poorly designed. There's a survey that was done by 56 libraries over 118 hospitals, covering 16,122 physician, nurse, and resident over the meaning of the library, and 75% of those answered that they have probably or definitely changed how they handled some aspects of care given the information that they have been provided by the medical librarians. And most of those who visited the library found that this information is of value. That's why more of teaching, more of helping people know the techniques of the right research and retrieving the right information must be done or approached by the medical librarians. Especially that the evidence-based medicine is a gold standard nowadays. It's not just evidence-based standard nowadays, it's become precision medicine, which is EBM plus customized care. So retrieving this evidence-based medicine is very, very essential. And searching the website is okay, and Google, we get tempted to use it. In the medical field, it is okay to use it if you use it properly and if it's the last resort after the many other medical bibliographic databases. Let's just agree on that. Google has 58% of the diagnosis correct. However, it leaves us with the 42 that are incorrect, which is a big probability in medicine. This cannot be. Let's move into the...
It was funny.
The time work frame, which is the other constraint in the medical librarians, causing medical librarians headache. It's because of the new emerging roles that are there. The data science is a new emerging field which requires new duties. It's like an interdisciplinary of science and research together. The changes in the private and the public federal funding requires and encourages sharing of data, and sometimes it mandates it. So what does the medical librarian have to prioritize? On top of it, the systematic reviews. The systematic reviews are lengthy processes of interviews and back and forth interviews between the practitioners and the researchers and so on and so forth. The third constraint is the budget. Medical librarians have to do more with less. The budget constraints affect the number of the staff and affects the hours of the staff. So it gets back up to the time constraints. The medical journals have increased in cost by 30% over the years, the 5 years, and the budget was increased by 5.7%. So the dilemma is here: what to choose, which journals to choose. The cost of the electronic journals always has been rising, and as hospital and healthcare settings, we're always being put as on the chopping block because we're non-generating revenues, especially in the healthcare setting. So we're always like, you have to remove this space because we need it for other departments. So we're losing space from the medical library. The National Library of Medicine presents over 1,200 plus open access databases. The Medical Library Association has to, like always, maintain public advocacy to maintain the budget. The National Institute of Health Public Access Policy provides open access data. Open access is peer-reviewed, up-to-date medical information, which adds transparency and helps in the workflow. But there's a constraint, which is to remove 12 months of mandatory deposits required by the federal department. Which gets us to the methodology. We have used the key terms medical librarian, health science librarian, challenges, barriers, and academic libraries to get 5 trade journals through the databases Google Scholar, and MLA. The databases that are used to get the 5 peer-reviewed journals were Redline, PubMed, Lista, and the CAT Plus. Of course, the limitations, we have chosen the 2010 articles plus, and the articles that have tackled the developing countries or the challenges that happened with the medical librarians in the developing countries have been excluded because they have different settings, as we do. If we come back to the survey that had 75% of people who say that medical librarians had given them information of value, definitely coming from a developing country, I would tell you this would be like 20%, and I'm being optimistic about that. So to recap, the outcome was the medical librarians faced disconnect, time constraint, and budget. And some recommendations to fix that were the increased outreach to the clinical professionals by being embedded librarians into the courses, the collaboration with other libraries, and some more communication with directors. And we highly appreciate more recommendations. Thank you. Yes?
I'm curious about what type of outreach, like maybe more specific examples that were given to outreach for clinical professionals. And I'm kind of thinking, I'm thinking along the terms of like systematic reviews, and where they're like how to search CINAHL and PubMed, because I know that can be confusing. Was there like workshops? Was there any information like, do you want to do a systematic review? Do you want to do an integrative review? Do you want to do a scoping review? Because I know there's like 15 different things you can get. So like, what kind of information was available?
Over doing these? You mean?
Or like the type of outreach librarians did for professionals.
Okay. As in the systematic reviews or the scoping reviews? I mean in the systematic reviews?
No, just in general.
Yeah. In the systematic reviews, let me just put it that way. It cannot happen without the librarians.
No, I know. I'm just
so.
No. My question is, like, what kind of information was available to professionals? Just like online, what general tactics did they take?
Okay, so MLA, not the one you're all familiar with, but the Medical Library Association. On their website, they do have a variety of links and like online training, as well as information about kind of how to go and set up training with your library. And they really do advocate that libraries that are in the area connected to hospitals, that interact with hospitals, that they do speak directly to practitioners and to the directors of those, because it's really hard to institute training without talking to the director first. There's also, as far as outreach goes, a lot of it's word of mouth. A lot of it's just having to navigate through the different administrative channels. But part of it is also going to forums and such, and really, in a polite way, kind of bringing up, hey, we can reduce mortality if you come and contact us. We can increase care. We are valuable and we are here to help you. Does that answer your question?
Yes.
One more thing is the librarians can be there in the orientation of the faculty. Just tell them that, hey, we're here in case you need anything, so please get back to us.
Certain if this came up, but I've recently been reading a bit about palliative care teams participating in clinical rounds, the monthly round where we've got someone who's in crisis care in a hospital setting, and they bring together 20 professionals, the doctors, the neurologists, all these. Is there any? Have you come across any articles where librarians are participating in this large meeting with the patient, the patient's family? The neurologist, all the different.
Yes, so in cases like that, it's not usually going to be a reference librarian. It's going to be a clinical librarian. There are librarians who specialize in going on rounds with nurses and doctors, and there are ones who get even more specialized in work with geriatric care or palliative care, or something like that, because you have to have a very specific kind of expertise, not just in medicine and in librarianship, but also in people to handle a situation like that. So we did come across it, and we considered kind of delving into that research a bit more, but ultimately decided it wasn't connected to the reference librarian.
I would just say that anybody open game here. But I would say that there's room here for research on that topic, because I've come up with almost nothing. I know it's happening.
It's mentioned a lot in passing in other articles. So if you're going and looking at the time constraints that medical librarians face, they'll talk about clinical.
It probably bumps up against that, but it's a good opportunity for someone here who might be thinking about independent research to consider this as an investigative area and a topic, because the amount of literature, tiny, on actual practice and recommended insertion, beyond just being in. It's the outreach issue, yeah. Anybody else? All right, then. It is 11:36, so we're going to get done a bit early. Oh, we have to clap for you first. Thank you so much. Excellent.